Bismillahirrahmanirrahim. I am Sadafa Freen. My roll number is BP1650191. I am a student of Doctor of Pharmacy Final Prof in University of Karachi. Today I am here to present some important information about folic acid. Folic acid is synthesis form of folate. Folic acid, which is converted into folate by body, are used as dietary supplements. Folates are also known as vitamin B9. Folic acid is needed for the proper development of the human body. Here is the molecular structure of folic acid. The molecular formula of folic acid is C19H19N7O6, means it has 19 molecules of carbon, 19 molecules of hydrogen, 7 molecules of nitrogen, and 6 molecules of oxygen. It is mainly indicated for the patients who have low folate levels, and the low folate levels may be due to anemia, or sometimes it happens in pregnancy and in liver or stomach diseases. But it is also recommended to the women to take 400 micrograms dose daily because it is not a proper medication. It can be used as dietary supplements and it helps our body to produce and maintain new cells. So it is recommended for everyone to take at least one tablet daily. Here is the pharmacology of folic acid. It is recommended and necessary for formations of coenzyme in metabolic systems, purine and pyrimidine synthesis required for maintenance in erythropoiesis. Erythropoiesis is basically a process of making up of new red blood cells, so it is very important for our body to produce and maintain new cells. It is also used to treat certain types of anemia. Folic acid is absorbed in proximal parts of a small intestine. It can be taken per oral daily. It is metabolized in liver and excreted through urine. Here are the dosage mentioned for different age groups. Like you can see in the above section, it is mentioned for the children, and then for adults, which includes males and females, and the dose is different for pregnant women and for breastfeeding women. Also, its injection dose is also mentioned, which is 5 milligram in 1 ml. Toxicity, as I said before, that folic acid is not a proper medicine like antibiotic, but it is very important for our body, and also it can use to treat several diseases. Here the side effects are not with the intake of folic acid, but they are mainly related when we take higher dose of folic acid. So it may lead to behavior changes, sleeping disorders, abdominal cramps, or nausea. Contraindication. It is contraindication for patients with folic acid hypersensitivity and also contraindicated in patients with undiagnosed anemia. Irrational use, as I said before, it doesn't have any side effect or toxicity when it takes in proper dose, but when you take too much of folic acid, then it may cause nerve damage. So doctors recommended to take it 400 micrograms per daily. Here are some Pakistani industries which manufacture folic acid with the brand name of folic acid, Folitab, and Nutrifactor folic acid. The dose and retail prices are also mentioned in this slide. These are two drugs with the name of daplin and L-methylfolate, which can be used as alternative of folic acid. They also perform function as folic acid does. Now moving towards a case related with the deficiency of folic acid presenting as pyrexia. Folate deficiency is an uncommon cause of pyrexia. Through this case, we will discuss and prove that how pyrexia is related with the folate deficiency. In this case presentation, we describe a case of 29-year-old male who presented with pyrexial illness subsequently attributed to megaloblastic anemia secondary to severe folate deficiency after exclusion of other infective or inflammatory cause. In this case, you can see that everything of the patient is approximately normal, but the serum folate level were found to be low at 1.2 microgram per liter, and vitamin B12 levels were also very low. So moving towards a SOAP's note. The age of patient, as mentioned before, is 29 years. The gender is male. The complaint is of fever and sweating, which is pyrexia. And the patient has a 6-week history of dyspnea or exertion, recurrent fever, and sweats. This is the vital of patient, which was conducted by the tested in laboratory of the hospital. As you can see that the level of hemoglobin, WBCs, and neutrophils, and as well as creatinine, they all are not in the range. So we'll discuss in our plan that how they'll come in the normal range. Okay, so our plan. Initially, this patient was started on IV broad spectrum antibiotics as he were presumed to be pyrexial, secondary to underlying sepsis of unknown origin. His main problem of anemia or any other disease was still unknown, but they started antibiotic as he has a complaint of pyrexia. But in the absence of any positive microbiological test, antibiotics were stopped with continuation of B12 and folate supplementation alone. And after this, by giving him by stopping his antibiotics and giving him folate supplements and B12, it is observed that after day 4, his pyrexia got settled and his fever drops down to normal. As you can see on the right side above chart of the right corner, his temperature from day 1 towards day 6, as we can see that the doctor started antibiotics, and along with antibiotics doctor started folates, and then stops antibiotics but keep giving him folates. So you can see that his temperature or fever drops down to normal temperature. Along with this, doctors also checked his vitals, and now we can see that his hemoglobin, his creatinine, his sodium, neutrophils, WBCs, and platelet counts, everything comes in the range by only giving him folic acid and vitamin B12. The patient improved gradually after commencement of B12 and folate supplementation. On day 2 of admissions, his vitals remained stable throughout the admission. Subsequent measurement of B12 and folate levels at followed-up outpatient appointment showed normalization. Folate deficiency is a reversible cause of pyrexia that should be considered in any patients who presents with a pyrexial illness of unknown case. Treatment with B12 and folic acid has shown to cause rapid resolution of fever. This case supports hypothesis of pyrexia caused directly by folate deficiency. Measurement of B12 and folate levels should be requested as part of a screen sent for any patient who is pyrexial without an obvious cause. I hope I have delivered as much as I can to you. Thank you. Have a nice day.